I'm Rob Wilson, president of Employco. Welcome to this week's Employco HR Chat. With me is Jason Eisnett, our vice president of HR.
Hi, everyone.
So, Jason, a new rule that most people probably don't know about goes into effect, or rule or law, January 1st, that the government passed, I guess, during COVID.
Right.
On health insurance.
Yeah, the transparency and coverage, it's a healthcare comparison tool. So starting January 1st of 2023, all health plans, whether or not it's fully insured or self-insured, but all health plans need to have this tool available for their patients, their consumers, to be able to compare what would a knee replacement surgery or procedure cost for in this plan versus this one, or if this provider compared to this one. So it'll be a nice advantage for some of the patients out there to be kind of know what their cost will be in advance.
And assuming it does work and does work as it's supposed to, it is a great tool though for someone that, you said knee replacement. Not that I'm going to have one, but if you were and you had your favorite doctor, you'll be able to go on through your health insurance carrier and say Jackson Network or out of network and anesthesiologist. So you'll be able to get a good look at what your cost is. So that would take your surprise away from, because there's nothing worse than you go to a procedure and then you get the explanation of benefits, the EOBs afterwards, and say, I owe $2,000 or $3,000. So that'd be really helpful.
This will tell you if a deductible applies and what your co-insurance percentage is after that, or your out-of-pocket maximum, or are there any prerequisites required? So like back surgery, do you need to go through injections first? If you don't, how much is a deductible or the co-pays and things? So you can put in like Dr. Johnson in Naperville, Illinois. That's an in-network doctor, so it's going to cost you this. Or Dr. Smith in Chicago is out-of-network provider, so it's going to cost you more. It's a higher deductible. So it'll be nice that, and January 1st is the first 500 conditions. And then starting January 1st of the following year of 2024, it'll be all conditions covered by the health plan.
So right now it's just your top 500 conditions.
Right.
So, but that should be a helpful tool.
Yeah.
So if you have questions, feel free to reach out to Jason or myself. Happy to answer any questions on it. And hopefully, and this will be from the insurance carrier. So hopefully the websites are up and running and the tools will be ready to use in January.
Yeah. So if you have a fully insured plan like our plans are, the health insurance carrier like United Healthcare, Blue Cross will take care of all of it. But for some reason, you do have a self-insured plan, which is usually reserved for the bigger employers. Make sure your TPA or your carrier or someone is doing that, because the responsibility falls on you as the self-insured plan.
Right. Great. Feel free to reach out with any questions.
Thank you.
Thanks for joining us.